All right, so welcome everyone. Good afternoon on what, Tuesday, May 23rd?
Yeah.
And welcome to the seminar. I know we have a number of folks online and several here in the room, which I think you can probably see through this nifty OWL video resource we got here. So welcome everyone. This is the Core Facilities Seminar. Today, I am repping along with several of my teammates a newly funded research thrust in the Center for Personalized Health Monitoring, known as Health Tech for the People, or HT4P. So our objectives today, once I get this to advance again, there we go. So here's our brief agenda. We're going to give an overview and introduction to what HT4P is about in terms of some of our initial goals, leadership, key concepts, and how this intersects with other centers, institutes, and initiatives here on campus. We have two themes under the umbrella of HT4P. One that addresses primarily ethics of tech and the design of reproductive health technologies, particularly in a post-Roe era. And a second theme, which we're actually going to talk about first, which addresses human-centered design of tech to support aging in the context of dementia care. And then we hope to have some time for Q&A. I'm also going to give our my fellow team members an opportunity to introduce themselves. But first, just to give you a sense of what HT4P is about, and forgive me, I'm Ray Walker, I use they, them pronouns. I'm an associate professor, director of the PhD program in the Elaine Marieb College of Nursing, as well as an associate director of the Center for Personalized Health Monitoring. I am a co-director of this newly funded research thrust, along with Dr. Ravi Karkar of computer science, who regrettably had an unavoidable conflict today, but is also in the co-leadership of this team. So the focus of this theme is on ethics of tech and the use of accountable human-centered design, evaluation, and translation of health monitoring technologies for the public interest. And broadly, what we hope this theme will help to achieve is incubating new and interdisciplinary and particularly community-led teams and technologies in these domains of aging care and across the reproductive health spectrum, and drawing on expertise in existing collaborations here in ISLES and at UMass and beyond, including the Public Interest Tech Initiative, the Center for Nursing and Engineering Innovation, the Center for Community Health Equity Research, the Mass IT and Tech Center for Connected Care and Aging and Alzheimer's, and the Computational Social Science Institute, among others. We hope that this will serve as a resource and consultation space on topics like the use of human-centered design and/or equity-centered community design and design justice, principles of data feminism, ethics of tech, and how to engage with community partners and co-creators in the design, evaluation, translation, and critical analysis of some of the technologies we are now seeing. We hope to offer events and seminars, which we'll talk more about, and we have some funding also to put towards support of new community collaborations, as well as looking towards collaboration on grant proposals, small and large, to support the work in the long term. These are our commitments. The team came up with a set of living commitments. So these are dynamic commitments. In terms of the team, I'm not going to go over all of them now, but just to let you all know, if you're interested in working in this space with us, this is a living document we're also using in terms of our own ethics of how we go about this work. And here's a bit about our leadership team. I confess some folks had an opportunity to curate their information, others it is just taken from the public domain, but we have several people with us today. I'm actually going to let them introduce themselves when we get there. So first, of course, Dr. Ravi Karkar is the co-director from computer science, who focuses on designing, developing, and evaluating tools that can enable people to gather data and interpret personal aspects of their health conditions in the context of their daily lives. We have Dr. Ju Chung, who I believe is online. So Dr. Chung, would you like to introduce yourself?
Sure, thank you, Ray. Good afternoon. This is Ju. I'm a assistant professor in Elaine Marieb College of Nursing. My research interest is nursing informatics and biostatistics and machine learning and data. And I'm really happy to be part of this team. I hope to share later some of the part of the information as well. Thank you.
Dr. Chen. We have Jason Maloney. Jason.
Yeah, hey, everybody. My name's Jason. I'm a social worker by training. And for the past year, I've been here at UMass as the executive director of the Massachusetts Alzheimer's, the AI and Technology Center for Connected Care in Aging and Alzheimer's Disease, which is an NIA-funded P30 center here on campus based out of CICS. And it's a pleasure to be with everybody here today.
Thanks, Jason. We have Fran Berman. Fran, unfortunately, couldn't be with us today. Some of you may know Fran from the Public Interest Tech Initiative here on campus. There's many years of leadership experience in this domain, not just at UMass, but many other places. And she's been helping to guide that initiative as well as informing some of the work of this new thrust. We also have Mike Busa. Is Mike online today? Anyone know?
I don't believe so.
Okay. Many of you may also know Mike Busa. Mike is a critical part of the team here at ISLES, basically helped build the Center for Personalized Health Monitoring and many other things. And he has a central role in getting the course to work, supervising a lot of that work, and also collaborating very closely with industry and other partners. We have Dr. Jess Dillard-Wright. Dr. Wright will be joining us later, but they are a shock trauma critical care nurse with a background also in nurse midwifery, nursing philosophy, care ethics, and science and technology studies. They're an assistant professor at the Marieb College of Nursing. Some of the projects they've lately been involved in, leading a nursing and radical ethics reading group with the Center for Nursing Philosophy at UC Irvine. They sit on the national board of the Ethics and Human Rights Advisory Board for the American Nurses Association. They're a UMass Pitt Fellow, leading the team and other care as possible. We'll hear more about later. They're part of creating national policy for particularly the American Academy of Nursing, especially around issues impacting clinicians in terms of workload and documentation in the electronic health record and that data management, which is labor. And they're part of the National League of Nurses Strategic Action Group on Anti-Racism in Nursing. Some of the recent publications they put out or had accepted, including one that just came out this past week on post-human nursing, looking towards the future. They recently released a book on nursing futurities. And this is me. I do a number of things. I will say some of the areas I'm most focused on as of late. I am a nurse. I have a background both in community-based participatory research and qualitative methods, as well as measurement, statistics, and power in health research. I helped the University of Pittsburgh design this open access curriculum that's now live on equity-centered community design of health technologies. All of this is available online. If you want to go to the website at the bottom, there's a series of curricula and modules that are free to anyone. That is an NIH-funded initiative. And this is one of several things I've been writing lately, including this idea of our commitments to new futures in a world where technologies like artificial intelligence, big data, machine learning are proliferating. What do clinicians and designers have to do in terms of ensuring that we are continuing to foster health and well-being in that context? And this is an excerpt from a chapter in a book that actually Dr. Dillard-Wright just published on that topic. So in terms of some of the resources and events of this thrust, we do have a number of events planned, including a kickoff event. We're not officially kicked off yet. We'll be kicking off officially in September. And that will be another opportunity for folks to get to know each other, learn more about what everyone is doing and how we can work together. Monthly seminars, a mid-year planning workshop, and team incubator, an end-of-year report and symposium, and some theme-specific offerings. We hope also that this work will lead to new research collaborations and grant proposals, some shared vocabularies across our diverse disciplines, everything from social work and nursing to computer engineering, and white papers, tools, and other metrics and guides to how to do some of this stuff, both specifically in our domain areas, but also more broadly, such as thinking about surveillance, data privacy, implications in terms of algorithmic bias and transparency and algorithmic justice, and what we should be doing or thinking about in our current legal and political landscape with all of this work as well. So in terms of how we interact with other UMass entities, we are officially part of the Center for Personalized Health Monitoring, but we do have team members representing a number of other existing initiatives on campus, including, again, PIT, SHARE, the Mass AITC initiative, and others. Our hope is that we're not going to duplicate or supersede any of the work people are already doing, but rather just work together to amplify our resources. And here is a brief overview of the specific research themes, which I'm going to have slides from Dr. Karkar here, but I also want to defer to some of the team leads for that proposal, which include Jason Maloney and Dr. and Ju Chung. So this is human-centered design of tech to support aging and dementia care. One of the central ideas behind this sub-theme is the idea of human-centered design, which Ravi provided some brief overview of for those who are less familiar with it. It's this idea of iteratively addressing complex problems by really centering the human perspective and the so-called end users, or people who are going to be ultimately impacted by that technology or design process throughout the process of coming up with the designs and solutions and implementation strategies. It was popularized by IDEO, and there's many other sort of variations on this theme as well now out there, particularly in industry, but also increasingly in academia, we're seeing this. So these are some of the people who are typically involved in that type of process, the users who will directly or indirectly interact with whatever you're building, the designers, which can include researchers or academics or other co-creators in the process, and the people who are ultimately going to have the power to affect or be affected by the design. This is some of the typical steps in the IDEO process of, sometimes this is referred to as design thinking, human-centered design in terms of, again, the iteration between researching and really trying to understand first what is the problem you are solving from the perspective of the persons who are ultimately going to be most impacted by the design, coming up with a variety of solutions or possible strategies for addressing that problem, trying them out, seeing what fits and what doesn't fit, getting lots of feedback on the way, which is testing and iteration, and finally coming up with something that's ready then to move to the next stage of implementation and possibly then continues to get refined, expanded, or scaled. These are some of the initiatives of that sub-theme. So I don't know if Jason or Ju, you'd like to say more about projects you're working on?
Thank you. Sure. Jason, or it's okay, I can talk, or you, or
Sure, go ahead.
Sure.
I'll just.
Sure. We had actually about 3 slides here to share. The first one was the aging, and ADLD is some term that Alzheimer's disease and related dementia. So it's a very important part of in aging as well, and technology networking. One of the things is we hope to have an event that identify and convening researchers in aging, ADLD, technology, designs from all across the campus, including nursing, public health, computer science, psychology, or any other department and colleges for purpose of the networking and sharing our trust this research. The hoping to develop a more current list of the people and share our funding opportunity, some more like a starting some way of event. We hoping to do by, I mean, we haven't decided when, but we thinking maybe during the summer by the Zoom with some breakout rooms. Further detailed information we gotta share, but it could be the starting seed for our future work together. So second part, I want to share maybe the next slide. Thank you. We hope to have developed some of the design of the tool. As we mentioned about the human-centered design in ethics, I mean, ethics play the critical role in guiding the human-centered design. Need to be responsible, inclusive, and respectful of one person's dignity or in our whole community. So we're hoping to using the Delphi method with 2 phases. We're gonna have some literature review, expert panel, on campus and external panels. We review where we can have the existing ethical guideline about the technology, AI, digital transformation in ethics related to human-centered design. You have a question? Maybe did I? Sorry. Yeah, if you have a question, please, let me know again. So we had 2 phases for using the Delphi method to develop the tool, especially to address the ethics in human-centered design. Ultimately, we want to share with the students and faculty, our center, and also the community. Next page slide is including how we want to thinking about the community outreach. I mean, it's not just ourselves. We want to work together as a community in where we are. So we're hoping to including base day health section of the geriatric, palliative medicine, which involving memory clinic, geriatric outpatient clinic, inpatient service, or home-based palliative care. We had one of the doctor who's a chief medical doctor in the geriatric department. We hope to have a connection to further our research and work together, and Northampton neighbor as well. So I mean, we are hoping to have some further way of addressing, especially more focus on older ADLD, and plus with the technology and networking as well. Thank you.
Thank you. And okay, I think that was it for sub-theme 1, but Jason, would you like to add anything?
Oh, sure. No, I would just say that, what you see on this slide is representing sort of the other side of the coin of the earlier slide about the internal meeting we want to have to sort of break down silos around folks who are interested in aging and Alzheimer's disease for research. And then this basically just represents some conversations we've had. And it was, I don't want to say easy, but it was great to talk with folks, both this Dr. Bonacera and this local grassroots organization who have access to lots of older folks, including those people living with dementia, and are both interested in research in terms of participation, collaboration, to be engaged as stakeholders and simply to learn about what's going on in the field of aging and again, cutting right to our theme here, how they can be involved with bringing the folks that they care for to the design process and to just learn more about what's going on in aging here at UMass Amherst. So it's exciting. If anybody wants to talk about potential collaborations with these folks or with these organizations, just let me know. Yes.
Do you want to plug the event at the end of today?
Oh, sure, I can, or I can do it now.
Yeah, if you want.
So we actually are holding a webinar through Mass AITC. Is there a slide?
There is. I can try to quickly get there.
That's coming up in just 40 minutes. So I'm actually gonna have to leave a few minutes early, but I thought it was really apropos to this topic, and there it is. And anyway, this is a gentleman from University of Michigan, and we'll be talking, just like we've been talking about here today, about user-centered design for older adults. This webinar is happening very, very soon, but you could certainly go on and register. And once I get done talking, I'll jump on the Zoom and drop the registration into the chat. So if you're interested, please check it out.
All right, get us back to where we were. But thank you, Jason. Thank you, too. All right, we are community outreach. Okay. All right, so that is sub-theme 2. Doesn't matter 1 or 2. That is our aging sub-theme. And then we have another sub-theme. This one focused more on reproductive health and tech ethics. I would say here, reproductive health is defined extremely broadly. So we're not just talking sort of narrowly about, say, pregnancy or a particular demographic or age group. We're really thinking about this across the lifespan and across all demographics and genders, not just one set. So some of the reasoning behind this sub-theme is that we are seeing a proliferation of many different forms of technology, which are not necessarily new, but they are certainly cropping up more and more. We also believe that nothing is inevitable. All of these are the products of human choices and design choices. But we do know from the research and especially research on this concept of algorithmic appreciation, that people do tend to trust AI and other forms of automation in some cases more than other humans. This comes from some research where people were getting health recommendations, and if they thought that a computer was involved in some way in the generation of that recommendation, that particular study found that people tended to trust it more. We also live and work in a techno-social society where no technology is necessarily good or bad or evil, but nor is it neutral though, because anything we build, hopefully we're building something that will support people and have help people have better outcomes, but also technologies and data can be weaponized. They can be used in ways that weren't intended, and they can have certainly unintended consequences. So we believe that we need to start moving from this idea of a social contract, which clinicians like nurses have talked about for many years, sometimes designers and other groups as well, to this idea of a techno-social contract, where we think about not just the technologies we're designing and sort of the mechanics of how to make something work, but also what it means in terms of power and other commitments and how this fits into the broader social fabric. So we think this has implications for certainly clinicians who are data workers, whether that's nurses or physicians or others, including social workers, and also some really stronger and more deliberate and intentional looks at our ethics and how we go about this work. Not just the first do no harm principle, which has been around for a long time, but also what obligations do we have as we create new technologies or evaluate what we have in terms of healing and repair and accountability, and thinking about this over the long term, both in terms of the present as well as what's already occurred in the past and what we can learn from that. So we think that there's already a lot, there's a lot of groups already driving this type of thinking who've been working on this for literal generations, a lot of that coming out of community-driven spaces or spaces where we see groups that have perhaps been marginalized in technology design or in other areas of society, really leading the way. And a lot of this is happening, although increasingly we're seeing some overlap, but a lot of it's happening outside of healthcare formally and computer science and informatics, although it has implications for all of us. And we know it ultimately does impact all of us. This is a shot from one of our former doctoral students, family members of nurses carved up in COVID gear in a hospital in Colorado in the middle of a COVID surge. You see the EMS personnel and vehicles in the foreground. There's snow on the ground, and on the horizon is an urban wildfire, which is rather extraordinary. But we know that everything we're doing has ripple effects. We have to think about sustainability. We have to think about climate change. We have to think about groups other than just ourselves and the ones we see in what we design. So the rationale for this subtheme, particularly in terms of reproductive health tech, is that there are a lot of apps, devices, technologies, ways of capturing data currently on the market, from period trackers and fertility trackers to other social media platforms, sensors, etc. And a lot of it's very unregulated. Much of it's also designed according to some fairly narrow norms and assumptions in terms of what is a typical human or human experience. And a lot of it is also now implicated in our legislative landscape, which includes increasingly hostile spaces in some cases, particularly towards trans people, other minoritized and racialized people, migrants, and other groups where data may expose people to even greater risk in some cases than they ever were before. And we know there's a lot of work. Some of us are already working with these groups to address this, including groups like the Black Mamas Matter Alliance, Trans Health Northampton, which I helped to advise, Data for Black Lives, and the Algorithmic Justice League. And we know that our current ethics systems, like the Institutional Review Board, which we of course have here at UMass, really fall short of the level of protection and consideration we need to be thinking about as we move increasingly into some of these types of tech spaces. So we hope that this sub-theme, guided by equity-centered community design, principles of data feminism, and design justice, will establish and maintain a funded reproductive health tech community advisory board. Also, as Dr. Chung was mentioning earlier, in terms of the aging care tech, we want to focus on the creation or amplification of existing practice guidelines and community-generated impact metrics. We do have a plan to write a T32, which is a NIH training center grant for pre and postdoctoral training in this area, and possibly some smaller PIT proposals or other proposals that would be adjacent to that. And by the end of next year, what we hope will come out with, among other things, is a set of community partner directed strategic priorities, a sort of roadmap and set of protocols for how to think about doing this work, both here in Isles and also beyond. We think that that'll be accomplished through, we already have a funded nursing PIT fellowship, which has a team that has a few slides in a bit. We have planned a quarterly tech ethics and design leading group, where we'll be looking at some work, probably starting with works like Dr. Rua Benjamin's Viral Justice, among others. A monthly issue is Style Seminar, which we hope to have co-directed with community partners, where we don't just get the academic take on a problem, but also people with the lived experience of the challenge really guiding that discussion. And then to participate in other broader thrust events like the launch mid-year and end of year closeout. In case you are not as familiar with some of these concepts, like data feminism or design for co-liberation, this is an open access text out of MIT Press by Catherine D'Ignazio and Lauren F. Klein that outlines some of these principles, particularly thinking about data, again, not just in terms of metrics, but power, and how we can start to think about that in new ways, including in the realm of tech. So thinking about examining power, we're all very familiar probably with the idea of surveillance. For instance, this is a TSA scanner. This is what shows up when, in this case, the non-binary person who passed through the scanner and wrote the book Design Justice passed through the scanner. The scanner is coded to identify people in terms of binaries, male or female. So if you are non-binary and if your body morphology does not conform to what the parameters of the scanner are pre-programmed to recognize as safe or not safe, no matter what you do or what button they push, you will get patted down. And I have been patted down 5 out of 5 times I've been to the airport lately. So I'm starting to think maybe that's not a coincidence. So we know that it has implications for how we design our machines. Simone Brown also wrote about how some groups in our society we know are hyper surveilled. You know, you walk into a room or a building or a meeting and all eyes are on you, maybe because you are an only in that space or you stand out. So surveillance is a suggestion that she has and others in terms of then turning the focus of our data gathering back from just individuals in community settings towards the structures that are actually most impacting our lives. This is still from the Library of Missing Data Sets, because we know a lot of these data are deliberately not collected because we haven't necessarily thought deliberately about how to collect that data. For instance, an index of how accountable a particular set of industries is for the types of reproductive health data it's collecting or data brokering that's happening. The state of Washington just passed landmark legislation severely limiting industry's ability to collect private health data and take that across state lines. That legislation was the outcome of academics who are deeply engaged with groups like the Black Mamas Matter Alliance, as well as privacy organizers coming together to put together a model and set of suggestions for how a state could help better regulate tech, especially in spaces we know it's not adequately regulated at this time. And we know this is a big problem in health settings, particularly because so many of the algorithms that drive clinical decision-making in healthcare in spaces like the electronic health record are black boxed, non-transparent, and when we audit them, we find that frequently they are not functioning up to the promises that have been made, and in some cases even doing very severe harm. We also think that tech should be consentful, not just compliant with legal standards, but also designed with an eye towards allowing people to have greater control over their data, that they can take it back, that they know exactly what's being shared, and that they're sharing it enthusiastically, not under the sort of coercion of feeling like, oh gosh, you know, you walk into a clinician's office, they hand you some forms, and it's like, if you want to get care today, you are going to fill out these forms, or else you are not going to see your provider. Those are some open access resources related to the theme. This is a project of Dr. Dillard Wright, who may be online with us now. I don't know, Jess, are you here? I know they're trying to get on. Yes. Actually, Lisa or Janet, would you be able to send the Zoom link to Dr. Dillard Wright? I think they're trying to get on, but they may have the wrong link. So Dr. Dillard Wright is the lead on tech ethics and also working with experts across the digital humanities, some of whom may also be present online. I'm not quite sure who's online, but just a brief explanation of what that is, because at least in my experience, IELTS has a lot of really cool stuff going on, but I've heard less discussion of digital humanities, particularly in this space. So this team, it's a nursing HIT team, and it's focused on bringing an ethic of care to health technology. So this is one of the ongoing projects. And digital humanities are concerned with the interface between computational technologies and the humanities. And of course, ethics and healthcare technologies are implicated in this. And we think nursing is particularly well poised to bridge this space, but certainly not exclusively. So everything we do to maintain, contain, and repair our world so that we can live in it as well as possible. That world includes our bodies, ourselves, and our environment. Joan Tronto and Berenice Fisher. So this is another Care as Possible, Art, Ethics, and Health Technologies. Again, part of the thrust under this theme on reproductive health tech. These are some of the current members of the fellows team: Dr. Dillard Wright from nursing, Hallie Bong from art, Rayanne LeBlanc, also from nursing, a gerontological nurse practitioner, Kirsten Lang from Women, Gender, and Sexuality Studies, and myself. Another Care as Possible is particularly focusing on, even in the context of reproductive health, this idea of also thinking about death and where that fits in, whether death in terms of end of life or pregnancy loss or abortion care or other spaces. So in the context of life, reproductive, and death decisions, communication between caregivers, care receivers, and communities has ethical implications linked to the power and knowledge differentials that structure professionalized care. With our PIT fellowship, we will address communicating complex ideas, the use of black box technologies in and as healthcare and for health, and new material care ethics in accountable and community-focused ways, focused on reproductive health and death care. And I will say, just from my own nursing experience, death care is a critical space, one we've certainly heard a lot about too in our COVID times, and one that continues to get far less attention, particularly when words like innovation or technology come up, even as all of these things are deeply, all of it is deeply affected by those technologies. So we're hoping to have, and again, this is Dr. Dillard Wright's work, which also they have served as a philosophy fellow, nursing philosophy fellow at UC Irvine. I see they're joining us now. And there will be a colloquium in October 2023 on speculative ethics for speculative care. Jess, I think you may have just joined us. Hi.
Hi.
I think I just got to the end of your slides, but I'm wondering if you would like to briefly summarize some of the work of the Another Care is Possible that you are working on?
Sure. I'm sure Ray went ahead and kind of introduced the folks that we're part of that initiative, and it's growing, which is exciting. So if you have any interest in joining the team, I think that there's space, and sort of congruent with the relational and idea that care is expansive. We welcome y'all to join with us as we think about what it means to care on a planet that is under duress. And forgive me, I'm just coming from the sustainability strategy working group workday today. So this is like really the sustainability angle here is really central in my mind right now. So in this public interest technology fellowship, Another Care is Possible, we really want to kind of think about the ways in which communication and care are fundamentally linked to power and knowledge, and kind of try and break down some of those barriers through use of different kinds of ethics that we in terms of technology and care, right? So we are all too often kind of revert to an institutional ethic or kind of biomedical ethics, and in many respects, when we're thinking relationally, these kinds of ethics break down. So how do we build the worlds that we imagine, not just the worlds that will if we don't change anything? That's sort of the central ethos of Another Care is Possible. And so we're kind of settling into a focus on end-of-life care, and including the end of pregnancies that end with pregnancy loss or stillbirth. I think that's all I have to say about that at the moment. The Nursing and Ideas Collaboratory is a sort of burgeoning initiative that's a collaboration between the University of California Irvine Center for Nursing Philosophy and the Charité Universität Medizin Berlin and the Elaine Marieb College of Nursing, as well as hopefully other institutional and campus partners. We'll be having our first colloquium in October of 2023, which is around speculative ethics for speculative care, kind of looking at a feminist new materialist and critical post-human mode of caring. In that space, we've confirmed 3 speakers. One is Brianne Donaldson, who's a scholar of Jainism, and we'll have Goda Klumbeit, who is a German feminist scholar of science technology studies, who'll be bringing in a sort of perspective on machine learning. And then we'll also have Zakia Aman-Jackson, who does really exciting and important work on what it means to be human in our current kind of post and transhumanist times. Really looking forward to this and the things that will unfold from here.
Thank you so much, Jess. And for jumping on after your other.
Sure. And forgive me, I'm sorry I was so late.
Oh, no. We're all doing our best here. And for my part, in terms of other projects of this particular subtheme, we have a grant that was previously proposed. It was not successful. We're kind of looking at revisiting that. It was originally imagined with some folks affiliated with Trans Health, which is located in Northampton, around this idea of digital defense. Sort of what does the community understand about the implications of all these data that are being collected? How are we equipping folks to navigate these spaces, including the healthcare space, and be sort of informed and able to operate from a position of greater power in those spaces, including there are already laws on the books that govern access to data and our ability even to access and revise our own health records, which can have huge implications for how algorithms then what they flag and what they suggest in terms of our care. So that's a project we're hoping to revisit this summer if anyone is interested in that space. It's again not exclusive to any particular gender or demographic or positionality. I'd be happy to talk to you and see where we might be able to collaborate. So this is contact info. We are working on a separate website for the thrust. If you follow this QR code or the little bit.ly link here, you'll go to a form that will put you on our listserv for more information, particularly as it concerns things like the launch event coming up in September. We have tentatively said that will be Monday, September 25th here in the LSL Conference Center and on Zoom. We are aiming for a Monday in September. It will either be Monday, September 18th or 25th, but most likely the 25th. And we'll send out more information about that as soon as it is available. Again, this wonderful seminar is happening at 3 that Jason has organized with Mass AITC that you can check out if you're not already registered. I think Jason put the link in the chat.
Ray,
Yeah.
may I say something about the last slide with the bit.ly link for the listserv?
Yes,
That would
please.
also, if anyone was interested in that aging kind of research networking event we were talking about earlier, please sign up for the listserv. That would be a good way to stay abreast about that event as we flesh out the details.
Yeah. Thank you, Jason. And with that, I think we've left a good quarter of an hour for any questions or discussion. Or if there are things you all are doing that concern these topics that you'd like to share or talk about. Am I allowed to stop the share? Okay. So with that, I'll stop the share. And